Health Canada approved Pfizer's new antiviral pill, Paxlovid, yesterday, but the question still remains, how will Canadians access it within the recommended 5-day window? Joining us now to discuss what is next, infectious diseases specialist Dr. Bogoch and Dr. Susy Hota. Thank you so much for joining us. Dr. Hota, if you're someone who's eligible to take this, you have to do it in this brief window. If you're vaccinated, sometimes the symptoms are like runny noses. You can't even get a PCR. How are you supposed to find out you have it, get the drug, and then start using it?
It's an excellent question because, like you said, people can have very mild symptoms early on in infection, and particularly if they're vaccinated, may not even recognize that something's going on, and the clock is ticking at that point. So that's one issue. And then another issue is, like you said, accessing PCR tests, and eligibility criteria have changed quite a bit, such that most people in the community are not able to access the test. So there are two barriers right there. And then on top of that, for people to understand if they're even eligible, which would be what triggers getting a test. You have to self-identify, am I at a high-risk group to actually benefit or be eligible to get this treatment? And so there's another barrier.
So if there's lots of things in the way, that's going to require the healthcare system to pivot in some capacity. Dr. Bogoch, how does that happen?
Well, I think that you would offer this medication in multiple venues to enable the greatest chance for success. You'd want this in primary care clinics, you'd want this in emergency departments, and you'd want this in pharmacies. These are places that have testing available on site, have people who can perform the test and interpret the results, for example, if you're using a rapid test on site, and who can initiate the medication on site, but while also having a good understanding of the person who's coming in, their medical history, understanding any potential drug interactions, and being able to dispense the medication to an eligible person.
You mentioned, though, that there are drug interactions. So, Dr. Hota, can we walk through that? Who could not take this?
There are a large number of potential drug interactions because of the way that one part of this medication works. And so it really does require a thorough review with a pharmacist or whoever is aware of your medications to know if something really important that you're taking, say a cardiac medication, could interact with this. And with other types of medications like blood thinners, it may change the levels of blood thinner in your blood as well. So adjustments might have to be made to your current medications. And in some cases, it may not be a good option to take this medication because of those interactions. And finally, with chronic kidney disease, there has to be a dose adjustment for some individuals. So, I think it's not so straightforward as here's a pill, I want it, I'm eligible, please give it to me. It takes a more thorough review.
Dr. Bogoch, anything you want to add about who can't do this?
No, I agree with Dr. Hota. It's not Halloween candy we're giving out, it's a medication, and you have to have a good understanding of the patient and the drug to make sure that you're providing the best course of therapy for the right person.
One last question here. If some of the people who are eligible to take this are the unvaccinated, because they would be at higher risk, what is the incentive then for someone who isn't vaccinated and isn't interested in getting the shot, hasn't been convinced so far, to now take it?
Well, I would start off by saying this cannot be a replacement for vaccination. This is another thing that can be added to our strategies to try and manage COVID, but it doesn't replace vaccination. And here's why. Vaccines will provide durable protection, and they've actually shown they've protected against severe illness across variants. And also, they protect you at the time that you're ill, they protect you now, they protect you later. There's no guarantee that you're gonna have access, as we've talked about, to these medications at the time that you need them, or, be able to fit within that 5-day time window.
Okay. Dr. Hota, Dr. Bogoch, as always, thank you.
My pleasure.
Thank you.